Everyone. I'd like to thank everyone for coming to this meeting. We've gathered together today to discuss the best path in order to move forward in supporting this client develop skills that will ultimately promote their ability to communicate independently with others, as well as to improve their overall quality of life. Now, I understand that for the past 10 years, they've been using facilitated communication, and we're looking at discontinuing that and moving towards a functional communication system. Now, today I'm going to be talking about PECS as our functional communication system. Now, PECS is a picture exchange communication system that exactly in the word it uses pictures in order to help those who lack spoken language skills in initiating requests or describing what they observe. Now, this is an applied behavior analytic program that is designed to be used during typical activities, daily activities, such as classroom, home. Can also be translated to patient professional settings, so doctor's appointments, dental appointments, so on and so forth. Now, going in further, it uses pictures, symbols, words, and even photographs of a specific object for them to request that item, comment on things, or ask questions, which all fall under the functional communication realm. Now, in the first phase, they are rewarded with the objects that they've asked for. That's called the physical exchange phase, which I just want to highlight importantly that PECS focuses on the exchange that is facilitated through these pictures. So through the 6 phases, they kind of graduate into a more generalized approach across multiple settings. Now, phase 1 is the physical exchange phase, which can be most commonly connected to the facilitated communication that this client is already undergoing. Now, in PECS, this uses the communication tools as a reinforcer, which are often removed from the access of the client, and then it is modeled physically through the therapist when they request an item. So that's more of that physical exchange. Then they move on to expanding their spontaneity. So that's when the therapist would remove themselves or move themselves further away to give the child an opportunity to initiate that exchange. Then it moves on to discrimination training, which is where they're given more than one picture and they have a choice. Then during phase 3, the next phase, which is sentence structure, I'm going to show you a photo, which is going to just highlight sort of what it would visually look like. So here it says, I want, with multiple objects. That could be an option for this child. So that would be our sentence structure and sort of generalizing across multiple different options that would be reinforcing for them. So that's a request scenario. Now we'll move on to the final 2 phases, which is when they're directly asked. So that's a lot of sort of the final putting all the pieces together. And then the final phase would more be a maintenance phase. So they would do that in different settings or just use it as their form of communication in order to maintain that. Now, PECS itself has accelerated across autism onto other developmental disability communities across dozens of countries, and the research publications for it have increased over the years, stemming from when it began in 1994. With many of these research participants having improvement in their communication. Now, with this being an applied behavioral approach, it can be integrated into the ABA programming. So a trained therapist or behavior analyst would be able to integrate that into their ABA sessions. Now, I want to touch on facilitated communication because that's what we were previously undergoing with this client. Now, facilitated communication, or sometimes referred to as assisted typing or supported typing, involves more of a physical hands-on approach. Now, this communication board and all of these things very directly can tie into the first phase of PECS. And they have worked for this client in the past, and they have shown tons of promise. But more recently, with the recent studies, the effectiveness of facilitated communication has been rarely and unofficially used. So I feel as though PECS would be a great transition point into functional communication training, considering the overlap in the two different systems and interventions that we would be using.